Hi everyone, this is Marian Traceman from the Home Health Consultant and Kelly McCarpy, and we're here to give you an update on today's CMS announcement on home health and hospice moratorium. So first and foremost, this is a temporary moratorium according to CMS, temporary for 6 months. However, in the past, we've seen these moratoriums that were supposed to be temporary for 6 months last like 5 years or whatever. So it's really going to be at the discretion of government officials whenever it is that they want to end it. So this could be 6 months, but it would probably last much longer than that. If we were to guess, I would say 5 years. How about you? What's your guess?
I'd say at least 2 to 3.
Okay, so long time.
Yeah.
The moratorium is not on every single thing. It is an enrollment moratorium, but it doesn't affect certain situations. So we're gonna talk about those situations really quickly. And before I jump into this, I just want to say the announcement was made like a couple of hours ago, and the document we're reading from CMS is in draft status. So things can change, they can clarify, there to be more. So this is like what we think so far. And maybe in 8 a.m. tomorrow, there's gonna be new stuff. So take this with a grain of salt. But so far, they have announced that this does not affect changes in practice location, except if the location is changing from a location outside the moratorium area to a location inside the moratorium area.
This really doesn't matter, meaning that this is a nationwide moratorium, so there's no place you can move that you're not going to be in moratorium. So this doesn't apply to any location change.
So just lots of words.
Yeah.
It also doesn't apply to changes in provider or supplier information, such as phone number or address.
So any basic information changes that are required to be recorded, those are still functioning as normal.
Probably staff.
Yeah.
Things like
Yeah.
It also doesn't apply to changes in ownership, except changes in ownership of home health agencies, hospices, and suppliers of durable medical equipment, prosthetics, orthotics, and supplies, also known as DMEPOS or DMEPOS, that would require an initial enrollment.
So where this does affect us is when you sell your license only, that does not have an accreditation as well, meaning you've only gone through first survey and not second survey, and you sell that 100%, that person has to apply for a whole new enrollment with NGS, the new owner. If that is not already in process, that's a no-go.
So it looks like no more license sales starting from today.
Yeah.
And finally, this does not affect any enrollment application that has been received by the Medicare contractor prior to the date the moratorium is imposed.
So basically, your initial NGS enrollment application would have to be received by NGS, meaning you have an application ID number by yesterday, essentially.
So that means that if your app is in NGS or whatever MAC you're with, even if it's not approved yet, it sounds like you're still okay for enrollment. So
what I will say about this though is there's not going to be an option for a second chance if for some reason that application does not get approved. So just want to make sure that those that are in process still, everything is responded to immediately, so that way there is no issues where they could reject the application because you can't resend.
Check your emails, check your mail constantly, and make sure any updates from NGS, if you're working with us, to forward it over.
Yeah.
What this also means is now more than ever, it's critical to maintain your compliance. If you have conditional survey deficiencies, immediate jeopardies, or anything that will shut down your agency, like bad ADR situations, whatever, there's no more like, oh, I can just start another one, like that whole concept is gone for a very long time. So please maintain your compliance. If you need help with that, give us a call. What's our phone number?
877-406-9727.
Thank you so much, and may the odds be forever in your favor.